We didn't have any outside people who wanted to come in today who registered? Okay. So then that brings us to the minutes. I had reviewed the minutes from last week and I thought everything looked fine. And so unless anybody had any corrections or concerns about the minutes, can I have a motion to accept those minutes, please?
Make
I
a
make a
motion.
motion that we accept.
All right, Bob and Kathy, and then all in favor, say aye. Anybody
Aye.
opposed?
Aye.
Okay, those minutes will be passed. So then we're on to the business of the day, and the first thing is the health inspection report was submitted today. So we have that in front of us. I had a couple questions about that, just some things I didn't understand. SR request, what does that stand for? I wasn't sure what that meant.
It's generally a service request from outside the department, or like the general public will call in the Citizen Service Center and we'll go deal with it. Plus, we also get them from the state and we'll go deal with this. It's just a service request. It's an itemized, a lot of it has to do with food services, or like, can I say, bad food in the store, or recalls, factory recalls in the grocery stores and stuff like that. So
But how, no, is this where somebody, like I would go in a restaurant and I would see something that I didn't think was right and I would call you mean, or?
it would be, well, you call us directly, or you call us through this, or something we reported to the state
Oh, okay,
Department of Agriculture, or to the City of Reading Citizen Service Center,
okay,
and kick back down to us.
okay. And the animal control inspections, what do they relate to?
Well, a lot of that has to do with the chickens, and well, basically it's just the chickens in the city of Reading, or animals that aren't, like if a resident has more than 6 animals, they need to have a permit.
All right.
Same with the chickens, they need a permit. And because being
And
in
is
the
that
health department,
working out okay with the chickens, or are there issues and problems with?
Oh,
it?
I was at the court twice in the last 2 weeks over chickens, so
Hmm.
they don't want to get rid of them. And
Yeah,
I feel their pain, but if you have a neighbor with the rooster right next to you, you don't want to hear that 24 hours a day. So
right,
I
right,
think
right.
just in the morning, that's not true.
And is it true that no roosters are allowed?
Well, not anymore. Well, you still could get it, but you have to have zoning approval now. So that's like $1,000 fee. So it's pretty much ganache in all the agricultural animals in the city of Reading limits. But roosters, they're the ones that cause all the problems. If people just have hens, we hardly ever get any calls on them because they're
Right.
just clucking a little bit. But the roosters, they could be pretty loud depending on the size of the rooster, and that's what generally gets reported.
Yeah, I can see that. I wouldn't want a rooster living next to me. Oh, I won't say anymore. You wouldn't be living there long. The product recalls, what do they refer to? I don't remember. What are product recalls?
Well, they had a thing with, I wish I would have done an itemized list. They just had Skippy peanut butter was just recalled. What else was, we had baby formulas recalled last
Okay.
month, and they revised that. But this is over the last, a lot of them are like mushrooms and stuff like that from all different vendors, and all some of the stuff's from overseas. And it's generated through the state system. The Department of Agriculture will kick us down, and we'll go out and check out local businesses, see if we can find them, or if they're even in stock, or if they removed them already. Generally, they're removed already, because the businesses are notified also, and it's all, we're just double checking. As well, in the last year, I've never found any that was recalled. So
So
Yeah, we
these
send
aren't,
out a list, it goes through our specialist up in Harrisburg, and it goes to all the local health departments as well as all the state inspectors whenever there's a recall of a product. Most of them are due to undeclared allergens and stuff.
oh. And are these things that are, I mean, once in a while, I'll read in the paper, oh, romaine lettuce has been recalled because of E. coli and don't eat it. But I assume there's lots of other things that get recalled that the public never knows about, or?
Yeah, sometimes. I mean, we get the master list from everybody, and then, the emails go out just so if you do see the product somewhere, you can make sure. Usually the manufacturers have a very good recall plan, and they know where their product went, so they can notify all the stores. But, in the case like Reading, you have a lot of those little corner stores that just go buy the product at Redner's. and take it, you know, into the store to sell it. So they wouldn't be on a master list to get that recall. So, you know, we just tell everybody, keep an eye out for it in case it's sitting in a store shelf somewhere.
But how would one know to, like, there were 17 recall products. Does that mean there were 17 different recalls that you had to go to all these stores to check, or there were 17 stores you went into to look
Well,
for?
no, it was 17 recalls. And we would just go and double check during our regular inspections, but we'll hit like market here and stuff like that. And a lot of the stuff, like I said, we can't, like, would be like almost specialty items that only a specialty store would have.
Okay.
Stuff like that. Like as far as like we had like a couple for mushrooms, you know, and I forget what the problem was. You remember what the problem was with Lynn with the mushrooms? Yeah.
I'm not offhand. I'd have to look back at my recall.
Okay. So you're doing these checks when you're doing your regular inspections. You're not
Inspections. Yeah,
you're getting of a recall and saying, "Oh God, we got to run out to these stores to." Okay.
But like we had a complaint for noodles that had rodents in and actually what's the other word, maggots and all that stuff. My partner went out and he says the owner already had it all cleaned off the shelves and boxed up, ready to get sent back to the manufacturer.
Okay.
So because these stores want to stay on top of it themselves, you know, they don't let this out, you know.
Yeah, John, I'll give you an example. Like I sign up for the FDA website. So here was a swap 24-hour aerosol antiperspirant powder that was recalled for benzene being present. So these alerts go out to anybody who has it as their listserv. And I think some of the stores then also get these alerts, and then they have to check their shelves and then remove from the shelf anything. So the FDA does have a listserv that people probably sign on to, or the manufacturers sign on to, and you get these bulletins. But I often wonder, you know, how many homes have this antiperspirant in their house? They may not have any knowledge that this has been recalled, but they do send out these kind of notices.
So if you bought like that antiperspirant at Weiss, would Weiss send you a notice? Likely or not?
I don't think so.
I've got a couple notices from Weiss already about something that I purchased. You know, it's usually something perishable, and I've gotten it already where it's like, well, I ate that 2 days ago. So
I think the things that get the national news, like the formula got a lot of national news and national press, that there's a public awareness, but there was a Mickey Mouse hand sanitizer that was recalled. So a lot of it, I don't think gets directly to the consumers.
Okay. And the what's the NOVs? What does NOV stand for? That was
notice of violations.
Oh, okay. All right. So that's where he gave somebody a warning, basically.
Yeah, and we'll do a recheck later on. Basically, NOVs for us would be something in the hood system, or the something in the floors of the businesses or something like that. Mechanical stuff mostly.
I got you. Now, the other thing I was curious is that, you know, it seems every meeting we have, we mention about how there's a high rate of turnover of businesses in the city. Is it even more so now that you happen to note that, or?
It's a lot of new businesses and new startup businesses that didn't exist before. I mean, with getting zoning approval, going from start to finish as far as opening up a brand new business. Before, it's usually just a business changing hands. So the store will be bought up by somebody else. And that's still going on, but what's really hitting us, it's a lot of new startup businesses that never was in this property had a business. And with us, it counts for the tattoo shops.
Okay.
And, you know, all that other, you know, the tattoo shops, and of course, all the food places and all that stuff we inspect.
Okay. All right. Any other discussion on the health inspections for the month? Okay, well then let's move on to the coronavirus update. And it might be interesting to hear, Dr. Kelleher, can you give us, I mean, you're on the front lines and I'm not. Give us an update from your perspective, because I know you're part of the council. Where do things stand today in Berks County, in your opinion?
I would say that things now stand the best that they've ever been. And so everybody's really taking a breath of air. The hospitals have some of the lowest hospitalizations. I think today, there was 7, but there was a time where there was only down to 2 and 1, none in the ICU, none on ventilators. The positivity rate in our area is very, very low. The demand for testing is very, very low. So we're clearly at a, an area where the numbers and the community transmission is one of the lowest it's probably been in 2 years. So that's reassuring and you're enjoying it and you're, but with that breath of fresh air often came the lifting of the mitigation strategies to prevent the spread of the disease. So most schools now have completely lifted the requirement for masks. Most businesses don't have the requirement for masks. And so in looking at the big picture, there are other countries, including England, that are starting to see a second surge. And so we're keeping our fingers crossed, but if we're looking internationally, there are definitely countries that are seeing another surge. When it's going to hit us or what it's going to do, I think is unknown. But right now, it's probably the best it's been since the pandemic began.
Yeah, I saw that this new B2 variant, they think is almost 50%, but doesn't seem more virulent, but maybe a little more infectious than the last variant.
Yeah, they're saying it's more infectious than Omicron, which is hard to believe because Omicron was so infectious. And then there's some evidence, again, not locally, but internationally, of that variant also having a mutation that may have the infectivity of the more infectious strains with some of the increase, lethality or morbidity, but that's to be determined. But right now we are, I haven't seen a positive case probably in at least a couple of weeks.
Oh, really?
And the demand for vaccines is also down. So with this new announcement of the booster, we wanted to know, would people be coming in, and our vaccination numbers are also down. So we're not seeing a lot of people jumping on the booster bandwagon right now.
Now, a question, a friend of mine about 5 days ago called me to tell me that he tested positive on an at-home test. And then he went to an urgent care was one of the Reading Hospital urgent cares. And they said, oh, we don't see many false positives. He had all the symptoms. They said, we're not going to bother test you a second time or whatever. So he went home and he quarantined. He's doing his thing. Now, would that have registered a person like that?
Yeah, you're required as a healthcare provider to report positive still. They have changed the reporting requirements, and you're not required to report negative point of care, which you were supposed to be doing in the past, but healthcare provider and sites are still required to report the positives. At-home testing, where people are doing that at their home without a healthcare provider, supervising it, those would not be reportable. Those are home tests that people are doing in their home with the delivery of home tests do not get reported to the state.
Now, I'm going to ask you a question that you don't know the answer to, but you might have a better answer than I could come up with. And that is, a lot of people like myself are now eligible for the second booster. But, I say to myself, things are pretty good right now. Should you take that second booster now or save it? If we get a big surge in 2 months, maybe it'd be better get that booster right before that surge. So what advice are you giving to your patients?
Yeah, the advice I'm giving to my patients are, that it is currently recommended, but I too similarly are thinking, should I wait?
Yep.
So I think but we often as healthcare providers don't follow the best advice. So I'm trying to make sure that my opinion doesn't become the opinion that I give to my patients. So right now the recommendation is if you're eligible to get boosted. So that's what I'm telling them. But myself, I'm wondering if I should wait a little while. But on the other side, I don't want to wait too long because you don't want to be caught as one of the cases that start this next surge.
And if it appeared as though there was another surge coming, then I think I'd be far more inclined to get it.
Yes, I agree. But I'm going to get it, but I'm not rushing.
On top of that, which is also probably not well defined, is I read more lately about I've had nothing but Moderna. So would it be better for the Moderna people to get a Pfizer booster and the Pfizer people to get a Moderna booster? Do you have an opinion on that?
Yep. A study did come out that's showing that mixing and matching vaccines may prove to have some increased immunity. So I similarly am a Moderna person, and I will likely get a Pfizer for my booster, just to see if that plays itself, because there is some evidence that you may have an increased immune response by mixing and matching the two products. Johnson & Johnson is out of it, so nobody should be getting a booster of Johnson & Johnson. So at this point, it's really Moderna and Pfizer.
Right. Okay. Another thing we talked about 2 months ago, and that was, I just keep reading all the, the great hope of the oral antivirals. And are they practically speaking on the scene yet in hospitals for people who come in who are sick?
They are on the scene. We have them here at our FQHC. And we ordered a limited amount to start with, not knowing what the demand would be. And then when we decided that we might order some more to get ready for a potential surge or increasing cases, they said you are not able to order more. So, you know, they are out there, but a lot of people would struggle probably getting access to them because there's not a lot of them out there.
Okay. Yeah, because I mean, some of the stuff you read makes it sound like, boy, if you get it early enough, it'll knock it down in 3 days and it'll be gone, kind of thing.
Yeah.
Yeah. All right.
There's a chat that Jeremy from the city fire marshal may also have an update. They put in the chat.
I'm sorry, say it again.
In the chat, they said, Michelle said that Jeremy might have some additional updates.
Oh, okay. Is Jeremy with us? Are you
Hello,
there?
can everybody hear me?
Yes, we can. Can you fill us in on how things are going with first responders and COVID from the standpoint of the city, et cetera?
Yeah, so at this point in time, you know, I certainly agree that things are going well. We are not seeing nearly the caseload that we were seeing. You know, just as a point on the national news, there are about, I think it's 16 states that are reporting an uptick. I did hear that last night. So, and I don't know if this is any kind of third, fourth, or fifth wave. I've kind of lost track at this point, but we're not dealing with COVID nearly anywhere close to the frequency that we had been in the past. So that's very good news. We have lifted our COVID restrictions based on the CDC guidance. But some of our guys are still electing to wear masks on a regular basis for emergencies, which is a good thing.
And from the standpoint of personal protective equipment, I mean, you got plenty of that, no issues there?
Yeah, we worked through several different suppliers and we were in very good shape. I mean, certainly we're the point of distribution for all city departments. So we have continued to kind of maintain our stock to try and stay ahead of the game. So as things became more available, certainly the price dropped back down. So we did order additional stock. Obviously, we get through the summer and we come into the winter months. If this becomes more of a seasonal issue, we'll certainly be well prepared for that with everything that we've had. We've also added some additional respiratory protection. We got a grant for PAPRs. So every member of our department was issued a PAPR hood. So we've increased our respiratory protection as well as half mask respirators. So
what is a PAP?
It's a powered air purifying respirator. It's a hood assembly that a hose goes, and it's basically a belt, and it's a filtered fan that sits on your hip. So the hospitals are certainly most familiar with these. When you would see on the news, the hospital health professionals wearing some sort of health headgear. That was probably generally a PAPR, but we have a hood that's a little bit different. But you know, for long-term work, it's much more comfortable to work in. Yeah.
Yeah, I know the feeling. We worked in things like that when we would do joint replacements, except that was a whole suit that you put your whole body. Any other discussion on the topic of coronavirus? I think we'll have a day sometime when that isn't on the agenda. Maybe. All right. Well, then let's move on to old business. Michelle, do you have anything to report about Berks Teens, whatever they're calling themselves now? I guess that's the first question. Have they decided on a new name?
They have dropped the Matters and are being known now as Berks Teens.
Oh, okay.
I missed the last meeting and they have not scheduled a new one yet. So they're kind of in a holding pattern while they reorganize.
Okay. All righty. And I would guess that now that schools are back in session, they'll get back to their usual program at school, because I know that was curtailed for a while, and or at least abbreviated. All righty. How about lead abatement? Does anybody here have anything to report on where we stand with the lead abatement programs? Mary, do you have any? You have some involvement with that.
Yeah, I know. They're actively starting to recruit patients and families. They were trying to concentrate on people who own their homes because they do have significant funding to do the renovations. And so we were able to run a report for City Hall of our patients who were lead poisoned and refer some people to the program. So I think they're in the active stage of assisting patients, I would say patients, sorry, families with renovations of their home, starting with people that own their home. It's a smaller percentage of people that own their home than rent their home. So their next step is also to work with landlords. But the program is starting and the ability to refer patients to the program is ongoing.
I know you've said previously, Mary, that you have a pretty vigorous and standard testing program in place for the young kids. Do you have any sense of what percentage of all the kids that you test have a value high enough that they need attention? I'm just curious whether that's,
We
half of
ran
1%.
just as an example, we ran a report of patients we seen in the last year who had a lead level greater than 5, and we had 86 patients who were children with a lead level that's considered poison. And that was just, a sampling of patients who had been seen. So I don't know the actual percentage, but I do know that Reading has one of the highest percentage of
Right.
children with lead poisoning in the country.
So of the 86 that you got positive, you don't know that was 86 of how many
Of what?
tested?
No, I don't know that
Hey,
number. I can,
interesting.
yeah, no,
I'd
I
be
can definitely
curious.
share that.
But 86 is a lot, it seems like. You don't want 86 kids being missed.
Yeah.
But are they not necessarily all live in the city of Reading, though, do they?
For the
Or would
most
they?
part, our patients that we serve here, for the most part, are kids from the city of Reading. There could be some, other zip codes, but the majority of our patients are from Reading.
Okay. All right. Anything else on lead abatement? How about the eviction moratorium? Now Rudy's not, or rather, Jamal's not here today. I don't know if anybody has anything to report on where that stands. I assume all the eviction moratoriums are now over, are they not? I'm not sure. Anybody know? I don't know. All right. And the county health department, I know you were involved with some of those discussions early on, Mary. Do you have any idea whether any more discussions are ongoing in regard to that, or?
I think the Berks County Community Foundation is trying to advocate for the placement of a county health department. The county commissioners are advocating, they don't call it a county health department, but they're looking, and I forget the terminology they're using, of the best way to have a system of coordinated delivered healthcare service for Berks County. And they've hired a consultant to look at that, but they haven't officially came out in support of a health department, but have look to support looking at the issue with a consultant. But the Berks Community Foundation is trying to support and advocate for the establishment of a community health, of a public health department.
All right. All righty. And any new business anybody cares to discuss? Anything generally on anyone's mind to bring up yet? All righty. And I assume the health code amendments and health board amendments, those are still being worked on. Anything we need to talk about today? I would guess not. Okay. All right. Well, then I don't know that we have very much more. I think it's still a good idea to Zoom, going forward. We don't know what the future holds. And I mean, there are a lot of people who show up, but I don't think necessarily could show up when we weren't Zooming. How's everybody else feel about that?
I've gotten used to it.
Everybody else happy to keep it for the moment?
Yeah, I find Zooming, I think it's the best thing all the way around. So,
Yeah, because I mean, a lot of you guys are sitting in offices and it's for you to, get yourself out, go down to City Hall, find a parking space, park. That's a pain. So, all right, well, let's keep doing that. And I guess our next meeting we can set for the usual first Tuesday in, when would that be? June already.
June 7.
That's not anything special, June 7th. There's no elections time around there. So, no, I guess that should be it. All right. All right. Well, then if there's no other business, and can I have a motion to adjourn the meeting?
I make a
Make a
motion.
motion to be adjourned.
All right, all in favor? All right. Back in 2 months. Everybody stay healthy, stay away from those COVID bugs.
Happy Easter.
Thank you.
oh yeah, happy Easter.
Bye-bye.
Yeah.
See ya.
See you, folks.